Second white coat. Subscribe and like. Let's learn medicine together.
All right, welcome to The Explainer. Today, we're jumping headfirst into a medical case that's going to show you just how critical these teeny tiny structures buried deep inside our brain really are. Think of this less as just a patient story and more like a detective novel, one that takes us right into the command center of consciousness itself.
So where does our story begin? Well, like so many medical mysteries, it starts in the emergency room. We've got a 74-year-old man found unresponsive at home. I mean, the clock is ticking, and right now the medical team, they've got almost nothing to go on.
Okay, so in any investigation like this, what's the first step? You got to examine the scene, right? Gather clues. And for these doctors, that scene is the patient. They need to do a thorough physical exam, and that's exactly where we're going to find our first real leads.
And wow, the clues they find are, well, they're specific and really alarming. First off, the patient is in a deep coma, totally unresponsive. He's also showing something called extensor posturing. His body is just rigid and straight. It's a reflex that screams severe brain injury. Then you look at his pupils. They're constricted down to tiny little pinpoints. And his blood pressure, it's through the roof, 240/120. Now, any one of these is a huge red flag. But all of them together, that's not random. That's a very, very specific pattern.
So this is the big question, right? For the doctors and for us trying to solve this along with them. What single event, what one catastrophic thing could possibly cause this exact combination of symptoms? It's got to be one thing that explains everything we just saw. So, what could it be?
All right, the team's got to look inside the patient's head. There's no other way. And our first huge piece of evidence, it comes from a CT scan. This is going to show us exactly what's gone so terribly wrong.
And boom, there it is. The scan shows an acute Pontine hemorrhage. Let's break that down. Hemorrhage, that just means a bleed. And Pontine, that tells us the location. It's happening in a part of the brainstem called the pons. You can think of the pons as this absolutely critical bridge that connects the brain to the spinal cord.
And listen, this wasn't just some random, out-of-the-blue event. Nope. The patient's history of poorly controlled hypertension, that's the culprit. That extreme blood pressure literally forced these tiny, deep arteries inside the brainstem to just rupture. So now we've got the what, a bleed, and the where, the pons.
But, just knowing where the damage is, that's not enough. Not if we want to really solve this. We need to figure out what specific structure got destroyed by this bleed. We need to get to the absolute epicenter of the disaster.
Now, tragically, the patient didn't make it. But the autopsy, it gave us the final, super precise clues we needed to crack this case wide open. It pointed to the exact anatomical address of the damage, a specific cluster of what they called pigmented, or colored, neurons, right there in the pons.
And this very specific address, it points to just one place, a structure called the Locus Coeruleus. And get this, the name itself is a massive clue. Locus Coeruleus is actually Latin for blue spot. Why? Because its neurons are packed with a pigment called neuromelanin, which perfectly matches what the autopsy found, pigmented neurons. See how it all connects?
Okay, this brings us right to the heart of the whole mystery. We found the structure. Now we have to ask, what did it do? What crucial chemical messenger, what neurotransmitter was being pumped out by this tiny little blue spot?
The answer? Norepinephrine. And we're not just talking a little bit of it. The Locus Coeruleus is the main source of norepinephrine for your entire brain. So that hemorrhage didn't just cause a bleed, it completely shut down a critical chemical factory.
So now we can see it. This new piece of information, losing the brain's main supply of norepinephrine, this is the key that unlocks the whole puzzle. It turns out the loss of this one single chemical explains every single one of the patient's symptoms.
See, norepinephrine is like a master regulator for the brain. It's what keeps us awake, alert, focused. It's a huge part of our stress response. And, absolutely critically, it's the primary fuel for a system called the reticular activating system, the RAS. And you can pretty much think of the RAS as the brain's main on switch.
So let's connect the dots. 1. The coma. You destroy the locus coeruleus, you starve the reticular activating system of its fuel, and just like that, the brain's on switch flips off. Instant coma. 2. The pinpoint pupils. While the bleed also damaged the nerve that are supposed to widen the pupils, so the opposing system takes over completely and clamps them shut. And 3. That rigid posturing. The damage in this part of the brainstem basically unleashes these primitive reflexes, causing that extreme muscle extension. Boom, boom, boom. Every single symptom. Explain.
You know, this case is so much more than just a fascinating medical mystery. It's a really powerful lesson in neuroanatomy. It shows us that the brainstem is organized kind of like a chemical map, where you have these specific spots that are in charge of producing specific chemicals.
Neurologists basically have a mental map just like this one in their heads. If you know exactly where the damage is, you can make a really good guess about which chemical system has gone offline. You can see our Locus Coeruleus right there in the pons making norepinephrine, sitting right alongside other big names you might have heard of, like the substantia nigra, which is all about dopamine.
And this is exactly why, in neurology, it's all about location, location, location. A hypertensive bleed could happen in a few different spots, but each location gives you a totally unique signature. A bleed in the cerebellum, for instance, you're going to see ataxia, a loss of coordination. But a bleed in the pons, as we've seen, that gives you this classic, absolutely devastating 1-2 punch of a coma and pinpoint pupils.
Okay, let's put it all together. Time to state the final diagnosis and wrap up everything we've uncovered in this whole investigation.
So here's the bottom line. The patient's uncontrolled high blood pressure caused a bleed in one tiny, tiny spot in the brainstem. That bleed wiped out the locus coeruleus. Wiping out the locus coeruleus shut down the brain's entire main supply of norepinephrine, and that led directly to a catastrophic and incredibly rapid loss of consciousness and all bodily control.
And unfortunately, because this one little area controls such fundamental, life-sustaining functions, the prognosis for this kind of stroke, it's just incredibly poor. The mortality rate is, well, it's very, very high.
It really leaves you with a final thought, doesn't it? This whole case is just a powerful and honestly, a humbling reminder of how profoundly fragile the brain is. Our entire experience of the world, consciousness itself, it all hinges on the perfect function of these tiny, intricate structures, no bigger than a fingertip, buried deep inside the oldest parts of our brain.